questions and then have a chance to actually see the kind of impact of what you're doing. So I'm Jared. I'm a human rights lawyer from Washington, D.C. I serve as outside counsel to the Bill and Melinda Gates Foundation, among my other fun assignments in my day job at a large law firm, and also have done a lot of work with the Global Fund as well.
My name is Socrates. I'm here with Jill. I am a physician in the States, doing my training in New Orleans, and I was in the...
And that's why I was employed to make PASADA grow. We've grown a lot. When I joined, we had 45 members of staff. Today we have about 196.
So how long ago did you join?
7.5 years ago.
7.5 years.
Yeah. The year prior to the year I came in, the annual budget was around $300,000. It's now almost $5 million. Obviously, the numbers of patients have gone up. We have over 48,000 patients registered. Actually, the numbers on that are wrong. And we have, from 2003, I brought in a strategy of decentralization. So bringing services closer to the people who need them. And as we do not charge anything for our services, we target the very poor. So the idea was to bring the essential services to the community level. Then there are all the psychosocial issues around it, because we're not just a health center, in which is the same.
Right, so the Global Fund is giving no money to Tanzania?
No, there are other rounds going on now.
There are other rounds?
Yes, I mean, I put in a concept note for round 8, which was accepted. And then we were told that round 8, the money had been reduced, and most of it was going to go for antiretroviral drugs, and the rest for central level strengthening. So we got nothing. But there were many organizations in Tanzania, for example, in Global Fund Round 3, which closed. They closed because they didn't get the Global Fund money. And they were people who were doing really good work on the ground.
Right.
But we were lucky as PASADA, we had a wide donor base, we still do. So we were able, the staff we'd taken on, the activities we did initially, we were able to absorb that into the organization because we had other funding.
And so where is the range of your funding coming from? Obviously, being with the Catholic Church, presumably some through parishioners, and no? Nothing.
One Sunday collection a year, which is about $1,500 a year.
Dealing with mothers and children and orphans, which is a whole completely different set of things, and you're talking about job training and income generating stuff. So I mean, I'm curious how to provide that continuum of services requires, staff with all different kinds of skill sets, and how do you manage that, given that you're pretty much doing anything that any person might need help with. You're kind of a one size fits all, but specialized and tailored to every person's individual needs. I mean, how do you coordinate those services across all the stuff that you do?
I just intervene and make sure that you capture some of this on the boxes. We're going to use it tomorrow. So some of the ecosystem, what the agency does, we're going to need it.
Yeah, I don't know.
Well, when I came into PASADA, there was no management team. There was a medical director, and there was the director who was in my place before, who was going. So my first job was to build up a management team, therefore to take people from the different disciplines that you're talking about that we needed for the services, to take qualified people with experience, and build up that team, which then had the job of building up their own teams within their various departments or sections.
Right.
Like, for example, you are going to provide antiretroviral and maybe managing respiratory tract infections, and then they support along that line. So they open many sites, and they give it, kind of protocol to be followed. Now, PASADA is one of the facilities which is falling under the protocol. But if you come here, then you will find a lot of things that have been introduced, which are, I would say, they are outside the protocol. But basically, they are responding to the needs for the people in the community we are serving. That's why you find a lot of initiatives, and of course, on the other hand, more expenses as compared to other facilities which probably would have the same mission as the National Care and Treatment or PEPFAR or whatever. So I would say within medical services, starting with the provision of antiretroviral itself. These drugs are provided, free of charge, and there are a few investigations accompanied with that package. But itself, it was so difficult to meet needs for our patients. Title. I felt so stupid when they asked me a question last week. I went there. So they said, "You doctors, you have to work with us. We can guarantee in this community, every single family in this community have their doctor, and they consult us in whatever matter happening in their family. They have to consult, and we are the one who advise them to go to the hospital." So he asked me, say, "How many families do you have as their physician?" I said 0. So it's true. In real sense, it is true. And they say it is not something which is just starting today. It is even, it's either third or fourth generation of the parents. They left they said, "Okay, Mr. Gilbert is your family physician." I would say is a traditional healer. So whenever you get any problem, you have to consult. So that is past.
It's like
And it's respect. So they will definitely go to them. So their argument was right. Like,
find that they were finding it very difficult to disclose to their husbands that they're HIV positive. So you find one partner is on ART, the other partner doesn't know. But with the ART, with the mobile VCT, we are now actually reaching couple.
Is the change in gender balance because the men are working and they can't get to
Yes, you can get them in the community. Right. Because men going to the facilities up until they are sick. But women normally, because of the pregnancy, they can go to a facility, they are tested and so on and so forth. And we know women are their carers, so they can go there with a family member and so on and so forth, so they get more information about the availability of VCT services.
Sorry, can we also add that the men, sorry, I'm being feminist in this, but it's also true, that the men prefer to go to drop-in sites where nobody knows them. They get their HIV status and then they disappear, they don't say anything to anyone.
Right. Going to the mobile site means that all the women in the community are looking at them being tested and saying, Okay.
For example, confidentiality is one of the few reasons in all our staff contracts for which a member of staff can be sacked from one second to the next if they breach confidentiality.
Revealing someone's status, for example.
Privacy is a different issue, but it's also, I think the culture is a bit different. Privacy in our cultures in the West is a much tighter thing.
Yeah.
Privacy here is a bit wider because of culture.
Right, so in essence, based on how you're defining the terms,
I mean,
there's not a lot of privacy, but you have complete confidentiality.
Yes.
Right, so people will know you're at the clinic, but obviously they're not going to know what you were doing there and whether you were there for TB or whether you're there for AIDS or, right.
And what Ben has said is that the mobile VCT has actually normalized HIV. Normalized in the sense that people are not scared of it, because you find people lying in there, I'm going for HIV testing.
They can be brought back into society. It went very well, the project. The only problem was that the donors said, no, we prefer you to give them handout grants rather than the loan scheme because of the price of the scheme. So, the microfinance can fit in anywhere. In all the populations we serve. The orphans who go through the vocational training program and then need to start small businesses because that's the only future they could possibly have. And another idea around that would be you use those kids who've gone through the vocational training successfully and you put them into cooperatives where they will then take on apprenticeships for other orphans coming out of school. So it becomes, you know, a network. We would love to do something like that, but to get money for something like that is very difficult.
Prince Charles actually has a youth entrepreneurship development organization, and they just teamed up with a young global leader in Brazil actually to do exactly this.
Oh, really?
Uh-huh.
And they have priority countries? Or?
No, Brazil was actually one of, it's the first country in Latin America they're doing this. They have a wide presence in Africa, across the region. I haven't heard of anything in
I'll look
Tanzania.
it up.
But I can also, I'd be really happy to put you in touch with the people that organize this, because
Yes.
it's exactly what you're describing, which is microfinance for younger people and oftentimes at risk, juvenile delinquents. And that's what he's doing in Brazil with actually another young.
Buildings were built with money that we raised. But we are within a parish that, by the way, didn't want us here. But because the Cardinal supports PASADA very strongly, and the issue that the Catholic Church must and has a duty to respond to the HIV and AIDS pandemic, the Cardinal said, no, PASADA is here and will stay here.
So do they play a role in terms of bringing people to you, in terms of the members of the church
We
speaking
work
about it?
on the field level with the Catholic dispensaries.
Yeah.
I mean, we have some of our sites,
There's value
our
on that
sites
front.
are in the Catholic dispensaries. I mean, there is that kind of course.
It's all in time.
Yeah, if you like. But the Catholic Church as an institution doesn't give us anything. It has one Sunday collection a year, I told you.
Yeah.
Comes out.
You can be able to get that support.
Because
But
expansion strategy, not a startup
Yeah,
strategy.
yeah. But you cannot be able to get money for startup expenses. No. For expansion you can, but the criteria they use is that you must have a very good prudent system of managing a scale. You must have a payment rate of not less than 98%, loan loss rate
Not less
of
than
1 to 2%, repayment rate of 98%. Yeah.
And your best repayment rate was 85.
Below that, yeah. So you couldn't qualify. And they will give you if you are profit making and commercial entity, not an NGO for giving away grants.
Do the other microfinance groups have 98% repayment rates?
The two that I mentioned do have that because they make sure that the clients pay up. They are ready to send people in jail, repossess their assets, in order to make sure their loans are recoverable. In fact, they use best practices, that is zero tolerance. The day that you don't pay back, the same day they come to your home and take up something that's equal to an outstanding loan. So people behave very well with these two organizations. And they have a very good success rate, but at the expense of the poor who have to give up their very dear and assets to recover outstanding loans due to sometimes unavoidable circumstances like sickness.
More projects along the
Right.
way.
Oh, sorry, Frank. Sorry.
What was that? Where are they? I don't know.
This building is an extension of that one, as a grey one.
Very clever.
Oh, they approved it. I mean,
It was all one building. What did the ARB say?
Frank, can you translate?
What is the
Message behind what it's trying to because if you take care of the mother, you
Yeah.
take care of the whole
Right,
family.
right.
And you can also bring in, you can bring the father in if you take care
Ladies
of the
first.
Yeah.
They're great
So,
posters. They're so beautiful.
So, and you see mothers, they are always, taking care of everything. So,
And the second?
the second one is encouraging, like, if you're having care and treatment or you are managing HIV, you should, make sure everything is it's like a supermarket.
Right.
So you have prevention of malnutrition, TB program, the care and treatment, all kind of stuff. It's like a supermarket, so everything is available. And but it has to be, organized, not like, like everybody can give whenever they feel like giving ARV, they can just dish
Right,
it out.
right.
So it's like, oh, okay.
Thanks so much.
Someone I think so.
Yeah. Let's check otherwise.
If not, it'll be a long walk through the mud.
Thank you, Mama.
I can get you back that way.
Yeah. That was the end.